Welcome to Soleo Health, where we help you simplify your complex care. In this video, you will learn how to administer your infusion using a Curlin 6000. Your medication has been pre-mixed by the Soleo Health pharmacist and placed in a plastic bag. Store all medication as directed. Some medications need to be refrigerated or frozen for stability. Although very uncommon, if the medication is frozen, remove a day's supply each morning and place it in the refrigerator to thaw. Remove one dose from your refrigerator 1 hour prior to infusing to allow the medication to warm to room temperature. Never heat or microwave the medication. Use each bag only once. Change the IV tubing as directed by your nurse. Wash hands thoroughly using soap and water for at least 20 seconds. Dry with a paper towel. Use your towel to turn off the faucet. With an antibacterial wipe, clean your work surface. Gather supplies on your clean work surface. Medication bag, pump, alcohol wipes, IV tubing set, flush syringes. Inspect your IV site for redness, swelling, tenderness, or warmth. If there is a change, do not infuse and contact your nurse. Inspect your medication. Is it expired? Is it the right medication? Is your name on the bag? Are there any visible specks or floating particles in the medication? Each dose should be free of cracks, leaks, floating objects, and discoloration. If you have any doubts, call your Soleo Health pharmacist. Remove tubing from wrapper and close clamps. Remove protective cover from bag administration port and IV tubing spike. Push the spike into the administration port on the IV bag. Do not touch the spike or the end of the administration port. Break off yellow tab from the free flow valve. Note, if your bags already have the tubing attached, the yellow tab may already be removed. Remove the air from the tubing by squeezing the yellow free flow clamp, allowing the tubing to fill with fluid. If your IV tubing has a filter, hold the filter upright until completely filled with fluid and you see the fluid continue past the filter through the end of the line. Open the door of the pump by lifting the lever on the top of the pump. Swing the door arm of the pump to the open position. Place the tubing into the pump by inserting the yellow clip into the slot marked with the yellow arrow. Insert the blue clip into the slot marked with the blue arrow. Close the door arm of the pump. Be careful not to pinch the tubing in the door lock. Click the door lever down to lock the door in the closed position. Swab the end of your IV needleless connector using an alcohol wipe. Allow to air dry. Do not blot or fan. Remove the cap from the saline flush. Holding syringe upright, gently pull plunger back to loosen and then push the plunger up to remove the air from the syringe. Attach saline flush syringe to needleless connector by firmly pushing and twisting. Gently but firmly flush catheter with prescribed amount. Call your nurse if you are unable to flush the catheter or it is more difficult than usual. Connect the IV tubing to the needleless connector. Unclamp IV tubing. Turn the pump on by pressing the orange on/off key. The pump will perform a self-test and then beep 3 times. A screen with program will appear. The cursor, highlighted area, will be on program. Select program by pressing the Yes Enter key. The screen will change to display Repeat RX, New Program. Your pump should be pre-programmed by your Soleo Health pharmacist or nurse. Move the cursor, highlighted area, to Repeat RX by pressing the down arrow key. Select the Repeat RX option by pressing the Yes Enter key. Your programmed settings will appear in the next 2 display screens for you to review. The display screen will scroll automatically. The Run Options screen will now appear. Press the Run Pause button to start your infusion. Once the infusion is complete, press the Run Pause button, then push the On/Off button to turn your pump off. Disconnect the tubing from your needleless connector. Swab the IV needleless connector with alcohol and flush the IV catheter with saline flush solution as before. Swab the end of your IV needleless connector again with alcohol and allow to air dry. Follow with the heparin flush if instructed to do so using the prescribed amount. Call your nurse if you're unable to flush your catheter or meet resistance. To remove the tubing from the pump, lift the lever on the top of the pump and swing the door arm of the pump to the open position. Remove the tubing from the pump. Discard used medication bag and tubing in the appropriate waste container.